What's going on, guys? This video is going to be catered towards females, and the reason being is because this is probably literally the most asked video I've had since I opened my clinics forever ago, and it's necessary, and a lot of people don't understand hormone replacement therapy for females. So I would say that about 80% of the women that come into my office who are interested in hormone replacement therapy or really don't know enough about it to even be interested in it come in for one of a few reasons, and the main reasons are going to be lack of energy, lethargy, lack of sex drive, and really those are the top three, but most of the time it's really just they don't really know what's going on. They just know they're not how they used to feel. So they're not able to eat the things they used to eat. They're not able to do all of those things like they used to be able to. They can't work out and lose weight like they were able to before. And that's really the true kind of signs of getting to the point in your life as a female where you do need hormone optimization therapy. And unlike male hormone replacement therapy, female hormone replacement therapy is a little bit more intricate, and it's a perfected craft. So a lot of people who do this don't do it properly, and a lot of people who have been on this have had bad experiences. And I'm gonna go into those experiences and those issues in this video, but the main thing that I really want to touch on first is there's really three key components to female hormone replacement therapy. You have estrogen, you have progesterone, and you have testosterone. Now, testosterone is gonna be your energy, it's going to be your mood, it's going to deal with your increase in sex drive. But when you deal with sex drive in females, you have a lot of components to it. So you have normal, just overall sex drive, wanting to have sex, right? And that's going to be your testosterone. Then you have vaginal dryness, right? As you get older, that's just something that happens. So that is specifically catered to estrogen. So a decreased estrogen level is going to cause vaginal dryness. Now, the feeling of sex and the positives of that feeling or the desire to have sex is really going to be from progesterone. So you have progesterone that handles blood flow. An increased sense of blood flow to any area is going to make it more sensitive, and that's going to give you that increased desire while you're having sex. So those three things are really, like I said from the beginning, what really cause females to come into the office. So now I'm going to go into all of them just a little by little and give you the key points to each and every one of them and kind of the negatives too, because I obviously want to make sure that you guys understand the positives of female hormone replacement therapy and the negatives of it. So estrogen, right? Estrogen is going to help you with night sweats. So is progesterone, but it's also going to, like I said, decrease vaginal dryness. Now, the problem with estrogen and the thing that I see more than anything else when it comes to females that come into my office is women will start taking female hormone replacement therapy. They'll start taking a cream or a Troche or a pellet, and then all of a sudden they're going to gain weight, right? And that's because most people misdiagnose this part. And if you increase a female's estrogen too much, you're going to make them put on a ton of water. And a ton of water is going to make them think that they're getting fat. And that's where most females freak out and they stop taking the cream or the Troche. And you can't do that. One, that's just probably because you're taking too much of it. But two, it's just going to cause a whirlwind of different bad side effects in the body. But like I said, a very, very big negative effect of estrogen is going to be an increased water retention, which is going to make you feel like you're getting fat. And you're not. It's water. Most of the time, the body kind of fixes that over time, kind of the same way increased estrogen does in males, but females are just more sensitive to the fact of a scale going up when they're trying to get the scale to go down, and that's the reason why they come see you. So, biggest negative for estrogen, like I said, increased weight. Progesterone is going to increase blood flow. It's going to increase sex drive. It's going to increase desire, like I said. The only negative really with progesterone that I've seen from a patient standpoint is that too much of it obviously causes increased blood flow. So if you take too much progesterone, you can spot, like little bits of spotting throughout the month. And the second thing that I've really noticed, but this isn't way too high of doses, is going to be women brushing their teeth, getting like their gums will bleed. And again, that's just something simple. That's just due to the fact that there's an increased blood flow in that area. Testosterone. Now, testosterone is going to be the one where I would say 90% of females that come in, this is where you just start. We start with just testosterone. And the reason being is because, like in men, if you increase a female's testosterone level slightly, you're going to increase their estrogen level enough to usually fix all these issues without causing any water retention or any mood swings, okay? So testosterone is going to give you that energy. It's going to make you anabolic. It's going to make you lose weight. It's going to make you drop fat. It's going to make you increase your muscle mass. All of those things are going to really come from testosterone. Now, too much testosterone, just like too much of anything, causes negative side effects. And the negative side effects of this are going to be mood swings, black hairs. A lot of women will create they'll get like little tiny black hairs, not all over their body, but mainly in the spots where you're going to rub your cream. Under the chin, sometimes you see a few of them. You're going to get acne if you take too much testosterone, and that's one, the hormonal acne. It's like that chin strap acne. And like I said, guys, this is doing it wrong. This is not taking bioidenticals. This is really the synthetics, and this is just a poor case of over prescribing hormones. So those are the three main things. The growth hormone side of this, guys, if you haven't watched this yet, or I'm sorry, ladies, please watch the male video. And if you cut to halfway through the male video, I go over the growth hormone aspect of hormone replacement therapy. And those same positives and negatives of growth hormone are going to be for you. So there's really no difference in this for females and males. So go look at that video and you'll learn a ton about this. Next, I'm going to go into the different ways that we do hormone replacement therapy for females. And in our office, the main two ways we do it are going to be creams, and we're going to do troches. And a lot of people always call Revive, hey, do you guys do pellets? I really want a pellet. And I don't necessarily believe in pellets. And the reason why I don't is because when we were taught, when we went to the A4M, the Academy for Anti-Aging, to learn how to do all this, and they put on these peptide seminars, they basically give you a chart, right? And in the chart, it's going to say a patient has this blood level and they're this old, this is how many pellets they need. And unfortunately, no human being is the same. So my mom and whoever is watching this, your mom, are not going to absorb testosterone and absorb estrogen and absorb progesterone the same way. So unfortunately, there's really no perfect guide to that, right? So it's very trial and error. Hormone replacement therapy for females is a communication. It's learning your patient. It has a lot to do with really those first 2 months of just learning and understanding who you're dealing with. And there's no pellet that does that. So if I'm going to put a pellet in a patient and then they're supposed to take that specific regimen for 6 months, 9 times out of 10, it's not going to be perfect. And there's nothing you can do about it. So I've been able to witness horror stories, like the horror stories of female HRT. So I've had women come in my office with deep voices. I've had women come in my office with this nasty cystic acne. I've had women come in my office with almost like hair on their face. And these are all pellet stories that they just overprescribed or overdid the pellets, and they can't do anything about it. So they're literally on this roller coaster for 6 months, okay? And another negative of pellets, and this is something that I really truly believe in, is I've seen this on blood work. I've actually done this, like trial studies on patients that have done pellets, is the second the pellet is implanted, the levels are stable, right? Or they're too high. But what happens over time is they literally are gonna just decrease. And as they're decreasing, the patient feels worse and worse and worse and worse. And there's really nothing, like I said, you can do until 6 months in. So this whole time they start and they feel good when they start, but it's this slow decline, and no one wants that. You want an average good feeling daily. You want to have a sustained normal dose every single day. So what we do at Revive, and it's a lot different than a lot of other offices, is we're going to use creams and troches, but the first 2 months of your therapy with us, we're going to compound all of them separately, okay? So you're going to take your testosterone separate, you're going to take your progesterone separate, and you're going to take your estrogen separately. And it's going to take us time to do that perfectly. So we're going to have you come back for blood work sometimes every 2 weeks until it's literally perfect. But once we get the therapy perfect, then we combine all those creams into one, or all those troches into one, where you literally have a perfect formula made for you. It's not the same formula as your friend's taking, and that's the problem. No one is the same. So this is the only way to truly do this and do it the right way. So if you come down here, it's going to talk pellet, troche, cream, and injection. Okay? Pellets, positives and negatives. So the positive of a pellet is convenience. It's true, right? It's so convenient to have to take one injection and then literally not have to worry about it for 6 months. I understand that. But all the negatives really don't add up to make it relevant. You have the guessing game of the doses being different. You have huge issues with peaks and valleys in therapy. And just like I said, all those horror stories. Troches, now the difference between a troche and a cream, a troche dissolves under your tongue. So between these two, the cream and the troche, I actually like the troche better because I feel like the patient absorbs it much better. So this is a sublingual absorption. That's a great positive. It's easy, right? There's no mess. There's no cream on your arm. You can regulate individually until the dose is perfect. Like I said, we're going to compound them separately first. And then the negative is it does take 5 to 10 minutes to dissolve. So you're going to have it under your tongue for 5 to 10 minutes. It doesn't taste the greatest, but at the end of the day, I mean, who cares if it makes you feel better? Now, creams. Creams, topical application, it's a positive. It's pretty easy to do. No needles. And you regulate individually, just like I said about the troche. Now, the negative of a cream is, yeah, it's messy. It is subpar absorption. So there's a lot of different things that can get in the way of absorbing once it goes subdermal, right? It doesn't absorb 100%, obviously, but we can obviously regulate that to make sure that you still get the proper dose based off of the absorption rate. And traveling issues. So a lot of people and females who travel, I don't like the creams for because they're too big to travel with. So if you're a patient who's traveling and you're a businesswoman, I would recommend Troches over creams any day of the week. Injection is the last one. So I would say less than 10% of all of my patients all over the country at any of my offices do injections for females, but some people do like the convenience of an injection as a female. The difference between injection and all of these is these are all bioidentical. So your creams, your Troches, and your pellets are all made from plants and sterols, so they're not made synthetically in a lab, whereas your injection is. So you can get some side effects from synthetic hormone replacement therapy in females. And if you want to learn more about that, just think of birth control in females. That's the same kind of thing that synthetic hormone replacement therapy is for females. So this is a very basic guide really for females to get into it and just understand what HRT is. A lot of women don't even know what HRT is and that they can even do it. So a lot of females come into the office, they're here for an IV or they feel tired and they're lethargic and they don't know what's going on. And I usually get them to do blood work so I can kind of see what's really happening in their body. And this is the stuff that truly makes a difference. So if you are a female and you do feel like you have any of these issues, it would be a great idea to get your blood work done at any of my offices across the country. See any of my physicians, they all do the exact same thing in all the offices. And I think you'll be really happy with the results that you get.